Breathe deeply, filling yourself with calm. Exhale slowly, releasing any frustration or worry. Today, we're going to explore how to reduce blackheads without harsh methods, how to address these common skin concerns with patience, gentleness, and effectiveness. Blackheads are one of the most common skin concerns, and they often feel stubborn and frustrating. But here's an important truth. Blackheads are not a sign of poor hygiene or inadequate cleansing. They're a natural occurrence that happens when pores become clogged with oil and dead skin cells. The black appearance comes from oxidation, not dirt. Understanding this helps you approach them with less judgment and more effective strategies. Let's begin by understanding what blackheads are and why they form. Blackheads are open comedones, pores that have become clogged with sebum and dead skin cells. Unlike whiteheads, which are closed beneath the skin's surface, blackheads are open to air. The exposure to oxygen causes the trapped material to oxidize and turn dark, creating that characteristic appearance. Blackheads commonly appear in areas with more oil glands, your nose, chin, and forehead, the T-zone. Some people are simply more prone to blackheads due to genetics, skin type, or hormonal factors. This isn't something you've done wrong. It's just how your skin operates. The gentle approach to blackheads focuses on prevention, regular maintenance, and patient treatment, rather than aggressive extraction or harsh scrubbing. Let's explore each aspect. Prevention starts with proper cleansing. Use a gentle cleanser that removes oil and debris without stripping your skin. Cleanse once daily in the evening to remove the day's accumulation. Over-cleansing can actually worsen blackheads by triggering more oil production. For blackhead-prone skin, double cleansing in the evening can be beneficial. Start with an oil-based cleanser or cleansing balm. Counterintuitive though it seems, oil dissolves oil effectively. Massage the oil cleanser onto dry skin for a minute, allowing it to break down sebum and dissolve pore clogging material. Rinse. Then follow with your regular gentle water-based cleanser. The star ingredient for blackhead prevention and treatment is salicylic acid, a beta-hydroxy acid that's oil-soluble. This means it can penetrate into your pores, dissolving the oil and dead skin cells that cause blackheads. Use a product with 0.5 to 2% salicylic acid several times per week. You can incorporate salicylic acid through a cleanser, a leave-on treatment, or a toner. Leave-on treatments are generally most effective because they have more time to work. Apply salicylic acid to clean, dry skin and allow it to absorb before applying other products. Start slowly, perhaps 2 to 3 times per week, and gradually increase frequency as your skin builds tolerance. Some people can eventually use it daily, while others find 3-4 times weekly sufficient. Listen to your skin and adjust accordingly. Retinoids are another effective option for blackheads. They increase cell turnover, preventing dead skin cells from accumulating in pores. Over-the-counter adapalene or prescription retinoids can significantly reduce blackheads over time. Like salicylic acid, start slowly and be patient. Results take several weeks to months. Clay masks once or twice weekly can help absorb excess oil and draw out impurities. Look for masks with kaolin or bentonite clay. Apply to blackhead-prone areas, leave on for 10 to 15 minutes until dry, then rinse with lukewarm water. follow with your regular moisturizer. Don't skip moisturizer, even on oily, blackhead-prone skin. Use a lightweight, non-comedogenic formula. Well-hydrated skin maintains better barrier function and may produce less excess oil over time. Now let's discuss what not to do for blackheads. Don't squeeze or pick at blackheads with your fingers. This pushes bacteria deeper into pores, causes inflammation, can permanently enlarge pores, and may lead to scarring. Your fingernails can damage delicate skin around pores. Don't use pore strips. These may provide temporary satisfaction by removing some surface material, but they're harsh on skin, can cause irritation, don't address the root cause, and blackheads quickly return. They're not a solution, just temporary cosmetic improvement with potential for damage. Don't use harsh physical scrubs with rough particles. These irritate skin, spread bacteria, and don't effectively clear pores. The particles are too large to enter pores where blackheads form. Don't expect instant results. Blackhead reduction is gradual. With consistent gentle treatment, you should see improvement over 6 to 12 weeks. Quick fixes don't exist, only patient, consistent care. If you feel you must extract blackheads, do so very carefully and rarely. After a warm shower when pores are softer, wrap clean fingers in tissue. Apply very gentle pressure on either side of a blackhead. If it doesn't release with gentle pressure, stop. Forcing it will cause damage. Apply a spot treatment after any extraction. Better yet, consider professional extraction by an esthetician or dermatologist who has proper tools and training. Professional extractions are safer and more effective than DIY attempts. Let's discuss complementary practices that support blackhead reduction. Steam your face occasionally before applying treatments. Hold your face over a bowl of hot water for 5 to 10 minutes with a towel over your head to trap steam. This softens the contents of pores, making them easier to clear with topical treatments. Don't overdo it. Once or twice weekly is sufficient. Use a konjac sponge for very gentle physical exfoliation during cleansing. These soft, plant-based sponges provide mild texture without harsh abrasion. Replace them monthly as they can harbor bacteria. Consider oil cleansing or facial oils for your skin type. Jojoba oil, for instance, is structurally similar to sebum and may help regulate oil production. Apply a few drops to damp skin and massage for several minutes, then rinse or wipe gently with a warm cloth. Lifestyle factors affect blackheads too. Manage stress, which can increase oil production. Stay hydrated to support overall skin health. Eat a balanced diet. Some people find that dairy or high glycemic foods worsen their blackheads. Keep your phone, pillowcases, and anything that touches your face clean. These can transfer oil and bacteria to your skin, contributing to clogged pores. Be patient and consistent. Blackheads didn't form overnight, and they won't disappear overnight. With gentle, regular treatment using the methods described, you should see gradual but steady improvement. Remember that some blackheads are stubborn and some level of visible pores with dark appearance is normal and natural. You're not aiming for magazine-perfect skin. You're aiming for healthy skin with minimal congestion. As we close, embrace this truth. Gentle methods work better than harsh ones for lasting blackhead reduction. Patience, consistency, and kindness toward your skin will serve you far better than aggressive extraction or stripping treatments. May your skin clear gently. May you find patience for the process. May you treat your skin with the tenderness it deserves. Thank you for this time together. Be gentle with your blackheads and with yourself.
Effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Combining retinoids with other acne treatments provides advanced results. After retinoid tolerance is established, typically 8 to 12 weeks, carefully introducing benzoyl peroxide on different days, perhaps retinoid at night, benzoyl peroxide in the morning or on different evenings, can enhance overall acne control. However, this requires careful management. Combining retinoids with strong treatments too early in the process causes excessive irritation. Wait until you're using retinoids nightly without significant irritation before attempting combination with benzoyl peroxide. Combining salicylic acid with retinoids requires similar caution. Both are exfoliating and somewhat irritating, so combining them immediately is unwise. After 8 to 12 weeks of stable retinoid use with good tolerance, you might use salicylic acid cleanser in the morning and retinoid at night. The salicylic acid provides daytime exfoliation and sebum control, while retinoid provides nighttime cellular turnover and anti-inflammatory benefits. Oral antibiotics plus retinoids represent an advanced combination for moderate inflammatory acne. The antibiotic controls bacterial inflammation while the retinoid addresses cellular turnover and sebaceous gland normalization. This combination is particularly effective for acne resistant to topical treatments alone. However, careful introduction is necessary. If possible, allow 4 to 8 weeks of antibiotic therapy before introducing retinoids, then start retinoids at low frequency and concentration. Hormonal treatments combined with topical treatments represent a synergistic approach for hormonal acne in women. Oral contraceptives or spironolactone address the hormonal root cause, while topical treatments manage surface acne manifestations. This combination often provides superior results to either approach alone. For example, a woman might be on spironolactone plus doxycycline plus benzoyl peroxide, addressing hormone regulation, bacterial factors, and inflammation simultaneously. Chemical peels combined with home treatments provide enhanced results. Monthly superficial chemical peels combined with daily topical acne treatments provide more dramatic results than either approach alone. The chemical peel removes surface impurities and promotes cellular turnover, while daily treatments maintain and enhance the peeling results. Vitamin C plus niacinamide represents a complementary antioxidant combination that doesn't directly treat acne but provides skin-supportive benefits. Both are non-irritating and well-tolerated together. Apply vitamin C in the morning for antioxidant protection, and niacinamide can be included in morning or evening moisturizers. These support overall skin health during active acne treatment. Important principles for combination therapy. Never introduce multiple new treatments simultaneously. If you want to combine treatments, introduce them sequentially. Establish tolerance to one treatment before adding another. For example, establish stable benzoyl peroxide use for 4 weeks before adding salicylic acid to your routine. Use complementary treatments on different parts of your routine when possible. For example, use salicylic acid cleanser in the morning, brief contact, mild treatment, and benzoyl peroxide leave-on at night, extended contact, potentially more irritating. This separation minimizes cumulative irritation. Monitor for excessive irritation. If combining treatments causes significant redness, dryness, peeling, or sensitivity beyond what either treatment alone causes, reduce frequency of one or both treatments. You can use both treatments but at lower frequencies. For example, benzoyl peroxide once daily instead of twice daily, or salicylic acid 2 to 3 times weekly instead of daily. The sandwich method reduces irritation when combining treatments. Apply your first treatment, perhaps benzoyl peroxide, wait 20 minutes, apply moisturizer, then apply your second treatment, perhaps retinoid. This dilutes treatment somewhat and reduces irritation while maintaining efficacy. Some combinations should be avoided or approached cautiously. Vitamin C and benzoyl peroxide together can reduce vitamin C effectiveness, so apply these at different times. Retinoids and strong chemical exfoliants used on the same evening can cause excessive irritation. Separate these if combining. Benzoyl peroxide with niacinamide is generally fine, though separating them, benzoyl peroxide at night, niacinamide in morning moisturizer, is easier. Assessment of combination therapy effectiveness requires patience. Most people need 8 to 12 weeks of consistent combination therapy to determine if it's working well. Acne doesn't improve overnight. Allow adequate time for evaluation. Adjusting combinations based on response is important. If one component seems essential while another isn't providing obvious benefit, you might discontinue the less beneficial component. Conversely, if you're experiencing insufficient improvement, you might increase one component's frequency or concentration, or add an additional treatment, perhaps adding retinoid to an existing benzoyl peroxide and salicylic acid combination. Professional guidance is valuable when considering combination therapy for severe acne. Your dermatologist can recommend appropriate combinations, warn about potential interactions, and guide introduction sequencing. Don't hesitate to discuss combination therapy approaches with your dermatologist. Guide 24, Understanding and Managing Fungal Acne, Malassezia folliculitis. Fungal acne, more accurately called Malassezia folliculitis or Pityrosporum folliculitis, is often misdiagnosed as bacterial acne. This condition presents similarly to acne but results from yeast overgrowth rather than bacterial infection, requiring different treatment approaches. Understanding this condition prevents prolonged ineffective treatment with standard acne medications. Malassezia is a naturally occurring yeast on human skin. In most people, it colonizes skin without causing problems. However, in some individuals, conditions favor malassezia overgrowth, leading to follicle inflammation and fungal acne appearance. Unlike bacterial acne caused by Cutibacterium acnes, fungal acne results from yeast proliferation. Fungal acne typically appears as uniform, small pustules, often in clusters on the back, chest, and shoulders, though facial fungal acne occurs. The pustules are often quite uniform in size and appearance, less variable than typical bacterial acne. Fungal acne is often very itchy or uncomfortable, more so than typical acne. It often appears or worsens after antibiotic courses, as antibiotic elimination of competing bacteria. These are often effective for mild to moderate acne. Prescription topical treatments, tretinoin, adapalene, azelaic acid, cost $20-100 plus per month depending on insurance. Generic versions are often affordable, brand name versions cost more. Oral antibiotics, doxycycline generic, cost $10 to $30 per month typically, making them affordable. Oral isotretinoin can be expensive, $200-500 plus per month, even though the generic is relatively affordable. However, insurance typically covers isotretinoin for severe acne, bringing costs down significantly. Without insurance, isotretinoin can be prohibitively expensive. Spironolactone generic is inexpensive, $10 to $30 per month, making it affordable. Oral contraceptives for hormonal acne range from $20-100 plus monthly without insurance, though many are quite affordable. Insurance typically covers at least some options. Professional treatments, chemical peels $150 to $300, laser $400-1,000 plus, microneedling $200 to $400, are expensive and insurance rarely covers them. However, they might be worth pursuing if home treatment's insufficient. Insurance coverage varies widely. Some insurances cover prescription acne treatments generously while others cover minimally. Checking your insurance coverage for your specific treatments helps plan. Dermatology visits cost $100-300 plus without insurance. Some dermatologists offer sliding scale fees for uninsured patients. Community health centers often provide affordable dermatology care. Affordable acne management strategies. Start with over-the-counter treatments, use generic prescription medications if needed, ask dermatologists about patient assistance programs for expensive medications, consider community health center dermatology if cost is barrier, check insurance coverage before treatments. Many effective acne treatments are affordable. Cost shouldn't prevent access to basic acne treatment, though advanced professional treatments may be limited by budget. Guide 74. Traveling with acne and maintaining treatment consistency. Travel disrupts routines and changes in water, climate, and environment sometimes affect acne. Planning ahead helps maintain acne treatment consistency while traveling. Packing acne treatments. Bringing full-size bottles takes space and weight. Travel size containers, available at most pharmacies, help. Decanting products into smaller bottles also works. Ensure all liquids comply with airline regulations if flying. Jet lag affects sleep quality and can worsen acne through stress and hormonal disruption. Prioritizing sleep adjustment and jet lag management helps minimize acne worsening from travel. Different water quality in travel destinations affects skin. Hard water or heavily chlorinated water might irritate skin. Using bottled water for rinsing face, or adapting cleansing to account for different water, helps minimize water-related skin issues. Different climates affect acne. Traveling to humid climates from dry climates or vice versa might temporarily worsen acne as skin adjusts. Using moisture-appropriate products for the destination climate helps. Stress from travel worsens acne. Stress management during travel, exercise, meditation, sleep prioritization, helps manage stress-related acne worsening. Maintaining routine is important. Even if traveling, continuing your acne treatment routine helps maintain clarity. Making treatment part of your travel routine, like packing it with toiletries, helps ensure consistency. Some travelers experience travel acne from new environments, water, or stress despite normally clear skin. Understanding this is temporary and will resolve upon return helps maintain perspective. Professional treatments aren't practical while traveling. Continuing topical treatments and avoiding new triggering factors is realistic goal during travel. If traveling long-term, weeks or months, establishing local dermatology care if treatments need refilling helps maintain continuity. Guide 75, Acne in Specific Professions, Pilots, Surgeons, Healthcare Workers, and Others. Certain professions have acne-promoting environmental factors. Understanding profession-specific acne factors allows appropriate prevention. Pilots and flight crew experience repeated altitude changes, cabin air pressure, dry air, and frequent travel jet lag, all acne-promoting factors. Additionally, time zone changes disrupt sleep and stress levels. These workers benefit from aggressive acne prevention and hydration strategies. Surgeons and healthcare workers wear masks for prolonged periods, creating occlusion and friction-related acne under masks. The pandemic increased mask-related acne awareness. Prevention includes mask breaks when possible, changing masks frequently, keeping skin under mask clean and dry, and using non-comedogenic products. Chefs and kitchen workers are exposed to heat, steam, and splashing from cooking, increasing sweat production and skin irritation. Heat exposure worsens acne. These workers need frequent face cleansing and good ventilation when possible. Outdoor workers, construction, landscaping, etc., experience sun exposure, heat, dirt, and sweat, multiple acne-promoting factors. Aggressive sun protection and sweat management are important. Office workers with high stress loads might experience stress-related acne. Stress management helps. Sports coaches and trainers are often in hot environments with sweat and frequent manual labor. Prevention strategies similar to athletes apply. Makeup artists and beauty professionals might have acne from product exposure or allergic reactions. Using quality, non-comedogenic products and maintaining clean equipment helps. Understanding your profession's specific acne-promoting factors allows targeted prevention. Many occupational acne factors can't be eliminated, can't stop wearing masks as healthcare worker, can't avoid heat as chef, but adapting treatments and prevention to account for occupational factors helps maintain clarity. Guide 76, Acne Myths and Misconceptions, Separating Fact from Fiction. Numerous myths about acne cause misinformation and sometimes harm. Understanding common myths helps you avoid misinformation affecting your treatment. Myth: acne results from poor hygiene. Fact: acne isn't caused by dirty skin or poor hygiene. Gentle cleansing is important, but over-cleansing worsens acne. Acne results from follicular occlusion, sebum production, bacteria, and inflammation, not dirty skin. Myth: chocolate causes acne. Fact: chocolate itself doesn't cause acne. However, high-sugar foods, which chocolate often contains, might worsen acne in some individuals through blood sugar and insulin effects. Myth: greasy foods cause acne. Fact: eating fatty foods doesn't directly cause acne through dietary fat transfer to skin. Excess calories from any source might contribute to inflammation and acne, but greasy foods specifically aren't acne-causing. Myth: acne will go away on its own eventually. Fact: some acne improves with age, but many people experience persistent acne requiring treatment. Waiting for spontaneous resolution wastes years. Myth: toothpaste treats acne. Fact: toothpaste isn't appropriate for acne and contains irritating ingredients. While older formulations sometimes contain benzoyl peroxide in tiny amounts, modern toothpastes shouldn't be used on skin. Myth: picking acne helps it heal. Fact: picking worsens acne, spreads bacteria, increases inflammation, and dramatically increases scarring risk. Never pick acne. Myth: sunlight cures acne. Fact: while temporary UV-induced drying might make acne appear better briefly, sun exposure actually worsens acne long-term through inflammation and post-inflammatory hyperpigmentation. Sunscreen is essential, not optional. Myth: all makeup causes acne. Fact: while some makeup clogs pores, many non-comedogenic cosmetics don't worsen acne. Appropriate cosmetic selection allows makeup use without acne worsening. Myth: action can also cause micro-tears in your skin barrier, leading to increased sensitivity and irritation. For these reasons, dermatologists typically recommend avoiding physical scrubs if you have acne. Chemical exfoliation is gentler and more effective. There are two main types of chemical exfoliants: alpha-hydroxy acids, AHAs, and beta-hydroxy acids, BHAs. AHAs, including glycolic acid and lactic acid, are water-soluble and work on the skin's surface. They're excellent for general exfoliation, improving texture, and reducing the appearance of fine lines. However, they don't penetrate into oil-filled pores effectively. BHAs, particularly salicylic acid, are oil-soluble and can penetrate into sebum-filled pores, making them ideal for acne-prone skin. Salicylic acid dissolves the sebum and dead skin cell plug within the follicle, directly preventing and treating comedones. For acne-prone skin, exfoliating 2 to 3 times weekly with salicylic acid is generally appropriate. Some people with very resilient skin can tolerate daily use, while those with sensitive skin may do better with once or twice weekly exfoliation. Begin conservatively with 2 to 3 times weekly, observing how your skin responds over 2 to 3 weeks before increasing frequency. Exfoliation products come in various formats. Exfoliating cleansers contain salicylic acid and are used during your regular cleansing routine. These are gentle and convenient for daily use. Exfoliating toners are applied after cleansing and before other treatments. They're typically stronger than cleansers and are meant to be left on the skin. Exfoliating serums and treatments are the most concentrated forms and are usually applied 2 to 3 times weekly. Exfoliating masks are meant to be applied for a specific duration, usually 10 to 15 minutes, then rinsed off. When starting exfoliation, begin with a lower concentration of salicylic acid, typically 0.5% to 1%, and gradually work up to 2% as your skin builds tolerance. Many beginners make the mistake of jumping to high concentrations, causing excessive irritation, dryness, and peeling. This leads them to conclude that exfoliation doesn't work for them when the actual problem was starting too strong. The exfoliation process requires proper technique. Apply your exfoliating product to clean, completely dry skin. Applying to damp skin increases irritation and reduces effectiveness. Use your fingertips to apply the product gently, spreading it evenly across your face, paying special attention to areas where acne is most prevalent. Some exfoliating products are meant to be left on overnight, while others are rinsed off after a specific duration. Follow product instructions carefully. During the initial exfoliation period, expect some adjustment. Your skin may experience mild redness, slight dryness, or mild peeling. This is normal and typically subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, excessive peeling, or significant discomfort, reduce your exfoliation frequency or concentration. Listen to your skin, it will tell you what it needs. Never combine multiple exfoliating products on the same day, and especially avoid combining exfoliants with other strong actives like retinoids or benzoyl peroxide on the same night initially. This overexfoliation damages your skin barrier, causes excessive irritation, and can actually worsen acne. Once your skin is accustomed to each product individually, you can sometimes combine them, but do so cautiously and only if your skin tolerates it well. Some people experience purging when they begin exfoliation, where acne temporarily worsens as the exfoliant brings impurities to the skin surface. This is generally a positive sign that the product is working, and it usually subsides within 1 to 2 weeks. However, if purging lasts longer than 2 to 3 weeks or becomes unbearable, discontinue the product and consult a dermatologist. After exfoliating, your skin barrier is compromised and needs careful management. Moisturize generously with a product suitable for your skin type. Avoid other potentially irritating ingredients like vitamin C, niacinamide in high concentrations, or peptides on exfoliation days. Stick to basic cleanse, exfoliate, and moisturize. Use sunscreen religiously, as exfoliated skin is more susceptible to UV damage. Seasonal variations affect exfoliation needs. During winter, when skin is naturally drier, you may need to reduce exfoliation frequency. During summer, when skin is oilier and more resilient, you might tolerate more frequent exfoliation. Listen to your skin and adjust accordingly. Results from regular exfoliation appear gradually. After 4 weeks of consistent exfoliation with salicylic acid, you should notice smoother texture, fewer comedones, and generally improved skin clarity. Acne lesions should appear flatter and less inflamed. However, exfoliation is most effective as part of a comprehensive acne treatment plan, not as a standalone solution. Guide 4: Salicylic Acid, the Science, Concentrations, and Complete Application Guide. Salicylic acid has been a cornerstone of acne treatment for decades, and understanding its mechanism and proper use is essential for anyone dealing with acne. Salicylic acid is a beta-hydroxy acid, BHA, meaning it's oil-soluble. This oil solubility is what makes it particularly effective for acne-prone skin. It can penetrate into oil-filled pores where other water-soluble ingredients cannot reach. Salicylic acid works through multiple mechanisms. First, It acts as a keratolytic, meaning it helps dissolve the protein bonds between dead skin cells, promoting cell shedding. Inside the follicle, it dissolves the sebum and dead skin cell mixture that forms cum-dun plugs. Second, it has mild antibacterial properties, helping reduce bacterial colonization within blocked pores. Third, it has anti-inflammatory effects, reducing the redness and irritation associated with acne lesions. Fourth, it can stimulate cellular turnover, promoting healthier skin overall. Salicylic acid comes in various concentrations, typically ranging from 0.5% to 2%. The concentration directly correlates with effectiveness and also with irritation potential. A 0.5% solution is very gentle, making it suitable for sensitive skin or those new to salicylic acid. A 1% solution is considered standard for most people with acne-prone skin, providing a good balance between effectiveness and tolerability. A 2% solution is the maximum recommended concentration for at-home use, offering significant exfoliating power but requiring experienced use to avoid over-irritation. Professional-grade salicylic acid can be applied at concentrations up to 20 to 30% during chemical peels, but these are only performed in clinical settings and are significantly stronger than over-the-counter products. Salicylic acid products come in numerous formats, each with advantages and disadvantages. Cleansers containing 0.5 to 2% salicylic acid are the gentlest form. You use them daily during your regular cleansing routine, and the short contact time limits irritation while still providing exfoliating benefits. Cleansers are ideal for maintaining clear skin and for beginners new to salicylic acid. Toners or liquid exfoliants contain higher concentrations and are left on the skin, providing more potent exfoliation than cleansers. These are typically applied after cleansing and before other treatments, 2 to 3 times weekly. They provide more dramatic exfoliation than cleansers but also carry insulin surges, triggering increased sebaceous gland activity and androgen production, both of which worsen acne. Foods with high glycemic index include white bread, white rice, sugary beverages, refined cereals, and most processed snacks. Replace these with low glycemic alternatives, whole grain bread, brown rice, vegetables, legumes, and nuts. This dietary shift reduces blood sugar volatility and decreases acne-triggering hormonal responses. Dairy products, particularly milk, contain hormones and bioactive peptides that may trigger acne in susceptible individuals. Multiple studies demonstrate correlation between milk consumption and acne severity. The effect appears strongest with skim milk, likely because fat-soluble hormones are removed during processing, leaving bioactive peptides. If you consume significant dairy and struggle with acne, try reducing or eliminating dairy for 4 to 6 weeks to assess impact. Many people notice significant acne improvement after reducing dairy. If dairy doesn't appear to worsen your acne, you don't need to eliminate it. Omega-3 fatty acids reduce systemic and skin inflammation. Foods rich in omega-3s include fatty fish, salmon, mackerel, sardines, walnuts, ground flax seeds, and chia seeds. Eat omega-3 rich foods 2 to 3 times weekly or consider supplementation if dietary intake is insufficient. Studies show that increasing omega-3 intake improves acne, likely through inflammation reduction. Antioxidant-rich foods protect skin from free radical damage and reduce inflammation. Berries, blueberries, strawberries, raspberries, dark leafy greens, spinach, kale, colorful vegetables, carrots, bell peppers, tomatoes, and dark chocolate all contain powerful antioxidants. Eating colorful foods daily provides antioxidant support. Zinc supports immune function and skin healing. Foods rich in zinc include oysters, beef, pumpkin seeds, and chickpeas. Some evidence suggests zinc supplementation improves acne, particularly in zinc-deficient individuals. Typical supplementation is 25 to 30 milligrams daily. Don't exceed this without medical guidance, as excess zinc causes nausea and copper deficiency. Vitamin D plays roles in immune function and skin health. Sunlight exposure stimulates vitamin D production, but many people don't get adequate sun exposure. Vitamin D-rich foods include fatty fish, egg yolks, and fortified milk. Some people benefit from vitamin D supplementation, particularly during winter or in northern climates. Typical supplementation is 1,000 to 2,000 IU daily. Consult your doctor about appropriate dosing. Hydration deserves emphasis. Drinking adequate water, about 8 to 10 glasses daily, more with exercise, maintains skin hydration from within, supports detoxification, and promotes overall health. Proper hydration improves skin clarity and reduces compensatory sebum overproduction from dehydration. Limiting sugar and refined carbohydrates is perhaps the single most impactful dietary change for acne. Sugar causes inflammation throughout your body, worsens acne, and accelerates aging. Reducing sugar by replacing sugary beverages with water, limiting desserts, and avoiding processed foods with hidden sugar improves acne significantly. Most people notice improvement within 2 to 4 weeks of reducing sugar. Stress is a major acne trigger. Chronic stress increases cortisol production, which increases inflammation and androgen activity. Stress also triggers immune dysfunction, promoting bacterial overgrowth. Implementing stress reduction techniques is therefore essential. Meditation, yoga, deep breathing exercises, regular exercise, and time in nature all reduce stress and cortisol levels. Exercise provides multiple acne benefits. Regular aerobic exercise, 30 minutes, 5 days weekly, reduces stress, improves circulation, regulates hormones, and promotes overall health. However, exercise-related acne can occur from sweat and friction. Shower immediately after exercising, change into clean clothes, and avoid touching your face during exercise. Despite temporary exercise-induced acne risk, the overall benefits of regular exercise substantially outweigh risks. Sleep profoundly affects skin health. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, disrupts hormonal balance, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves acne. Implement good sleep hygiene, maintain consistent sleep schedules, avoid screens an hour before bed, keep your bedroom cool and dark, and limit caffeine in the afternoon. Alcohol consumption worsens acne through multiple mechanisms. Alcohol increases inflammation, disrupts gut health, which influences skin and dehydrates skin. If you drink alcohol, do so moderately and ensure adequate hydration. Heavy alcohol consumption noticeably worsens acne in most people. Smoking impairs skin healing, increases inflammation, and worsens acne. Smokers typically have worse acne than non-smokers. Quitting smoking improves acne and overall health dramatically. Gut health increasingly appears important for skin health. Poor gut microbiota diversity, gut inflammation, and increased intestinal permeability, leaky gut, correlate with acne. Eating fermented foods, yogurt, kimchi, sauerkraut, fiber-rich foods, vegetables, whole grains, legumes, and possibly taking probiotic supplements supports healthy gut microbiota. While gut acne connections are still being researched, the evidence suggests supporting gut health helps skin. Hormonal regulation through lifestyle is important, particularly for women with hormonal acne. Regular exercise, stress reduction, adequate sleep, and healthy diet all support hormonal balance. For women with PCOS or obvious hormonal acne, these lifestyle factors may reduce symptoms enough to minimize or eliminate the need for systemic medications like spironolactone or oral contraceptives. Important perspective: diet and lifestyle changes typically take 4 to 8 weeks to demonstrate skin effects. Don't expect immediate results. However, after 8 to 12 weeks of consistent dietary and lifestyle improvements, most people notice significant acne improvement. These changes provide benefits beyond acne: improved energy, better sleep, improved digestion, and overall better health. Guide 15: Professional dermatological treatments, chemical peels, laser therapy, and advanced technologies. Professional dermatological treatments provide powerful acne management beyond what home skincare achieves. Understanding various professional treatments, their mechanisms, appropriate candidates, and realistic expectations helps you make informed decisions about whether professional treatment is right for you. Chemical peels use acids to remove skin layers, treating acne, scarring, and texture issues. Superficial peels penetrate only the outermost skin layer and are the mildest type. These use low-concentration acids, 15 to 30% salicylic acid or glycolic acid, and require minimal recovery.
Welcome to this peaceful moment. Settle in and let's begin with a breath. Breathe in slowly through your nose. Hold for a moment and exhale completely through your mouth. Feel your body relax with that exhale. Today we're going to explore something remarkable: how something as simple as breathing can profoundly affect your skin's health and appearance. Breathing is something you do automatically, thousands of times each day, without thought. But when you bring conscious awareness to your breath, when you use it intentionally, it becomes a powerful tool for managing stress, supporting circulation, and promoting skin health. Let's start by understanding the connection between breath, your nervous system, and your skin. Your autonomic nervous system has two main branches: the sympathetic nervous system, which activates your stress response, and the parasympathetic nervous system, which promotes rest, relaxation, and healing. Your skin's health is significantly influenced by which system is dominant. When your sympathetic nervous system is activated, when you're stressed, your body produces cortisol and adrenaline. Blood flow is redirected away from your skin toward your muscles and vital organs. Your skin produces more oil, inflammation increases, healing slows, your skin barrier weakens. We discussed these effects in our previous conversation about stress. When your parasympathetic nervous system is activated, when you're relaxed, opposite effects occur. Cortisol levels drop. Blood flow to your skin increases, bringing oxygen and nutrients while carrying away waste products. Inflammation decreases, healing accelerates, your skin barrier strengthens, cell regeneration improves. Here's what's remarkable. Your breath is a bridge between your conscious and unconscious systems. While you can't directly tell your heart rate to slow or your blood pressure to drop, you can control your breath. And when you breathe slowly and deeply, your breath sends a signal to your nervous system. We're safe, we can relax. This activates your parasympathetic response. This isn't mystical or metaphorical, it's physiology. Slow, deep breathing stimulates the vagus nerve, the main nerve of your parasympathetic nervous system. This activation cascades throughout your body, including your skin. Let's explore specific breathing techniques that support relaxation and skin health. Diaphragmatic breathing, also called belly breathing, is foundational. Most people breathe shallowly into their chest, especially when stressed. This rapid, shallow breathing reinforces your stress response. Diaphragmatic breathing does the opposite. Place one hand on your chest and one on your belly. Breathe in slowly through your nose, allowing your belly to expand like a balloon. Your chest should move minimally. The movement should be in your abdomen. This is your diaphragm descending, allowing your lungs to fill fully. Then exhale slowly through your mouth, feeling your belly deflate. Practice this for a few minutes daily. Over time, this deeper breathing pattern can become more automatic. The 4-7-8 breathing technique is particularly effective for relaxation. Breathe in through your nose for a count of 4. Hold your breath for a count of 7. Exhale completely through your mouth for a count of 8, making a whooshing sound. Repeat this cycle 3 to 4 times. This pattern is deeply calming and can help quiet a racing mind or reduce anxiety. Box breathing, used by athletes and military personnel for stress management, is another powerful technique. Visualize a box as you breathe. Inhale for 4 counts. Hold for 4 counts. Exhale for 4 counts. Hold empty for 4 counts. Repeat several times. This creates a rhythm that calms your nervous system and helps you feel centered and grounded. Alternate nostril breathing from yoga traditions balances your nervous system. Use your thumb to close your right nostril and breathe in slowly through your left nostril. Close your left nostril with your ring finger. Release your thumb and exhale through your right nostril. Inhale through your right nostril. Close it and exhale through your left. This is 1 round. Continue for several rounds. Many people find this technique particularly soothing and centering. When should you practice these breathing techniques? Any time, but especially during stressful moments before sleep, upon waking, or during your skincare routine. Your morning and evening skincare rituals are perfect opportunities to incorporate conscious breathing. As you cleanse your face, breathe deeply. As you apply your products, maintain slow, relaxed breathing. This transforms your skincare routine from a task into a meditative practice that benefits both your mind and your skin. Now let's discuss the direct effects of proper breathing on your skin. Oxygen is essential for every cell in your body, including your skin cells. When you breathe deeply and fully, you increase the oxygen content of your blood. This oxygen-rich blood circulates to your skin, supporting cellular energy production, repair processes, and overall vitality. Skin that receives adequate oxygen has a healthy, vibrant appearance. that natural glow that can't be replicated by products alone. Improved circulation from relaxation and deep breathing means your skin receives more nutrients, everything your skin needs to be healthy. Vitamins, minerals, amino acids, antioxidants reaches your skin cells via your bloodstream. Better circulation means better delivery of these essential nutrients. Waste removal improves as well. Your skin cells, like all cells, produce metabolic waste products. These need to be carried away for your skin to function optimally. Good circulation, supported by proper oxygenation and relaxation, enhances this detoxification process. Collagen production benefits from reduced stress and improved oxygenation. Collagen synthesis requires oxygen and numerous nutrients. When your cells are well oxygenated and your stress hormones are low, your skin can produce collagen more effectively. Your skin's barrier function strengthens when you're relaxed. Remember, chronic stress weakens your skin's protective barrier. Relaxation does the opposite, allowing your skin to maintain its integrity and protect itself from environmental stressors, irritants, and moisture loss. Inflammation reduces. This is perhaps one of the most significant benefits. Chronic low-level inflammation, often driven by stress, contributes to aging, acne, rosacea, and numerous other skin concerns. Practices that activate your relaxation response, including conscious breathing, reduce this inflammation. Let's talk about facial exercises and facial massage, both of which can be combined with breathing for enhanced benefits. Facial massage, when performed gently, can improve lymphatic drainage, reduce puffiness, and promote relaxation. As you apply your skincare products, take an extra 2 minutes to massage your face. Use gentle upward strokes. Work from the center of your face outward. Use light pressure. You're not pushing hard, just encouraging movement of fluids and gentle stimulation of your skin. As you massage, breathe deeply and slowly. With each exhale, release any tension you're holding in your face. Your face holds stress, just like your shoulders or back. Your jaw might be clenched. Your forehead might be furrowed. As you breathe and massage, invite these areas to soften and release. Gua sha and facial rolling tools can enhance facial massage. These tools, used gently with appropriate pressure, can feel wonderful and support lymphatic drainage. However, they're not necessary. Your fingers work beautifully too. What matters most is the gentle attention you're giving to your face, combined with relaxed breathing. Let's address progressive relaxation, a technique that can reduce overall tension and benefit your skin. Starting with your toes, tense each muscle group for a few seconds, then release completely. Move up through your body, feet, calves, thighs, abdomen, chest, hands, arms, shoulders, neck, face. Notice the difference between tension and relaxation. This practice helps you become aware of held tension and releases it, reducing the physical manifestations of stress on your skin. Mindfulness meditation, which often focuses on breath, provides significant skin benefits. When you practice observing your thoughts without judgment, when you return your attention to your breath again and again, you're training your nervous system to be less reactive to stress. Over time, regular meditation practice can reduce baseline stress and anxiety levels, which directly benefits your skin. You don't need hours for these practices. Even 5 minutes of conscious breathing daily makes a difference. The key is consistency. Daily practice, even if brief, creates cumulative benefits that occasional longer sessions cannot match. Make relaxation and breathing part of your overall skin health strategy. You invest time in choosing products, applying them carefully, protecting your skin from the sun. Invest a few minutes daily in breathing and relaxation too. This internal work supports and enhances all your external skincare efforts. Notice how your skin looks and feels when you're relaxed versus when you're stressed. Pay attention to this connection in your own body. You might notice that after a restful vacation, your skin looks radiant, or that during stressful work periods, your skin becomes problematic. These aren't coincidences. They're your body showing you the mind-skin connection. For those with specific skin conditions triggered or worsened by stress, breathing and relaxation practices can be particularly valuable. If you have stress-triggered acne, eczema flares, or rosacea outbreaks, incorporating daily relaxation practices might reduce the frequency and severity of these flares. One important note: learning to relax is a skill, especially if you've been chronically stressed for a long time. Your nervous system needs time to recalibrate. The benefits for your skin and your overall well-being accumulate over time, just like skincare products do. Don't expect instant perfection. Some days your mind will be too busy to quiet. Some days you'll forget to practice. This is normal and okay. What matters is gently returning to the practice, again and again, with patience and without judgment. As we come to the close of our time together, embrace this beautiful truth. You carry powerful skin treatments with you always, in your breath and your capacity for relaxation. No product can replace the benefits of reduced stress, adequate oxygen, improved circulation, and your body's natural healing processes functioning optimally. Your skin is not just affected by what you put on it. It's profoundly affected by how you live, how you breathe, how you manage stress, and how you allow yourself to rest and relax. Attending to these internal factors complements your external skincare practices and often produces results that products alone cannot achieve. Take a deep, nourishing breath right now. Feel it filling your body with oxygen, activating your relaxation response, supporting your skin's health from within. This breath and every conscious breath you take is a gift to your skin and your entire being. May you breathe deeply and often. May you find moments of true relaxation in your days. May your skin reflect the peace and care you cultivate within. Thank you for this time together. Breathe well and be at peace. Welcome to this gentle space of healing. Breathe slowly and deeply, finding peace within. Today we're talking about how to treat whiteheads safely, those small closed bumps that appear on your skin and sometimes feel frustrating to deal with. Whiteheads, also called closed comedones, are pores that have become clogged with oil and dead skin cells, with a thin layer of skin covering the opening. Unlike blackheads, which are open to air, whiteheads are closed, creating that characteristic white or flesh-colored bump. The safe approach to whiteheads emphasizes prevention and gentle treatment rather than aggressive extraction. Squeezing or picking at whiteheads can cause infection, inflammation, scarring, and spread bacteria to surrounding pores, creating more breakouts. Let's explore how to treat them effectively and safely. Understanding why whiteheads form helps you prevent them. Excess oil production, dead skin cell buildup, pore clogging products, hormonal fluctuations, and inadequate cleansing all contribute. Addressing these factors prevents new whiteheads while you treat existing ones. The foundation of whitehead treatment is proper cleansing. Use a gentle cleanser once daily in the evening to remove oil, dead skin cells, and debris. For whitehead-prone skin, a cleanser with salicylic acid can be beneficial. It penetrates into pores to help dissolve clogs from within. Double cleansing in the evening ensures thorough removal of everything that could clog pores. Start with an oil-based cleanser or cleansing balm to dissolve oil-based impurities. Then follow with your regular water-based cleanser. Massage your cleanser thoroughly but gently, spending extra time on whitehead-prone areas. Don't scrub harshly. Gentle, patient cleansing works better. Chemical exfoliation is key for treating whiteheads. Salicylic acid is particularly effective because it's oil-soluble and can penetrate into pores. Use a leave-on treatment with 0.52% salicylic acid 3 to 4 times weekly after cleansing. Apply to dry skin, wait a few minutes for absorption, then follow with moisturizer. AHAs like glycolic or lactic acid exfoliate the skin surface, preventing dead cell buildup. Use 5 to 8% concentration 2 to 3 times weekly. Some people use salicylic acid and AHAs on alternating nights. Retinoids increase cell turnover, preventing dead cells from clogging pores. Over-the-counter adapalene or prescription tretinoin used 3 to 4 times weekly can significantly reduce whiteheads over time. Start slowly and be patient. Retinoids take several months to show full effects. Clay masks once or twice weekly help absorb excess oil and draw impurities from pores. Apply to whitehead-prone areas, leave for 10 to 15 minutes, rinse with lukewarm water, and follow with moisturizer. Always moisturize after treatment products. Even whitehead-prone skin needs hydration. Use a lightweight, non-comedogenic moisturizer that provides hydration without clogging pores. Don't skip sun protection. Many whitehead treatments make skin more sun-sensitive, and UV protection is essential. Choose a non-comedogenic sunscreen that won't contribute to clogged pores. For individual stubborn whiteheads, spot treatments can help. Benzoyl peroxide at 2.5% kills bacteria and helps resolve whiteheads. Apply as a spot treatment before moisturizer. Hydrocolloid patches designed for whiteheads can be applied overnight. These protect the whitehead from touching, absorb any drainage if the whitehead opens, and create a healing environment. If you absolutely must extract a whitehead, and this should be rare, do so only if it has come to a clear head and seems ready to release. Cleanse your hands thoroughly. Wrap your fingers in clean tissue. Apply very gentle, even pressure on either side of the whitehead. If it doesn't release immediately with gentle pressure, stop. Forcing it causes damage. If it does release, immediately apply a spot treatment and don't touch the area again. Better yet, consider professional extraction by a licensed esthetician who has proper tools and training. Professional facials with extraction can safely clear whiteheads without the risks of home extraction. Never use comedone extractors or other tools at home without training. These can easily cause scarring if used incorrectly. Don't pick, squeeze, or pop whiteheads that aren't ready. This spreads bacteria, causes inflammation, damages skin, and often makes the whitehead worse. Keep your hands away from your face. Don't use harsh physical scrubs, hoping to scrub away whiteheads. The particles are too large to enter pores, and harsh scrubbing irritates skin without helping whiteheads. Don't over-exfoliate thinking more will work faster. Excessive exfoliation damages your barrier and can actually worsen whitehead formation. Moderate, consistent exfoliation works better than aggressive treatment. Prevention strategies reduce new whitehead formation. Choose non-comedogenic products, skincare, sunscreen, and makeup. Heavy, pore-clogging ingredients contribute to whiteheads. Remove makeup and sunscreen thoroughly every evening. Sleeping in makeup is a recipe for clogged pores. Keep everything that touches your face clean. Change pillowcases frequently, clean your phone, wash makeup brushes regularly. Don't touch your face unnecessarily throughout the day. Your hands transfer oil and bacteria that can clog pores. Manage oil production through lifestyle factors. Stress increases oil production, so practice stress reduction techniques. Adequate sleep supports skin's natural regulatory processes. Balanced diet and hydration support overall skin health. Some people find that dairy or high glycemic foods worsen their whiteheads. If you suspect a dietary connection, try eliminating these foods for a month and observe results. Be patient with treatment. Whiteheads don't disappear overnight. With consistent proper care, you should see improvement over 6 to 8 weeks. Existing whiteheads gradually resolve and fewer new ones form. Track your progress. Take photos monthly to see improvements that might not be obvious day to day. Adjust your approach if needed. If after 8 to 12 weeks of consistent care, you're not seeing improvement, you may need to adjust products, add a treatment, or consult a dermatologist. When to seek professional help. If whiteheads are severe or persistent despite proper home care, if they're causing scarring, or if they're significantly affecting your confidence or quality of life, consult a dermatologist. Prescription treatments, stronger retinoids, specific antibiotics, or other medications may be necessary. For very stubborn or large whiteheads, a dermatologist can provide in-office extraction or cortisone injections that resolve them quickly and safely. Remember that some people are simply more prone to whiteheads due to genetics, skin type, or hormonal factors. This doesn't mean you're doing something wrong. It means your skin needs consistent preventive care and patience. As we close, embrace safe whitehead treatment, gentle chemical exfoliation, proper cleansing, appropriate products, and hands-off approach. With consistency and patience, your whiteheads will improve. May your whiteheads resolve safely and completely. May you resist the urge to pick. May your skin clear with gentle, patient care. Thank you for this time together. Treat your whiteheads safely and gently.
Perceive you. This perception, whether accurate or not, influences social interactions and self-confidence. Many acne sufferers report avoiding social situations, dating, or professional opportunities due to acne-related anxiety. Some experience body image disturbance and depression stemming from acne. The unpredictability of acne exacerbates psychological distress. Not knowing when breakouts will occur, having acne that doesn't respond to treatment despite best efforts, and experiencing setbacks after progress all contribute to frustration, helplessness, and depression. The search for the right treatment becomes emotionally exhausting. Acne's psychological impact justifies aggressive medical treatment even for acne that isn't technically severe by dermatological standards. If acne causes significant psychological distress, depression, or anxiety affecting quality of life, treatment should be pursued regardless of how many lesions you have. Your mental health is a legitimate reason for professional acne treatment. Several psychological strategies help manage acne-related distress. Cognitive reframing involves recognizing and challenging negative thoughts about acne. Rather than, "Everyone will think I'm disgusting because of my acne," reframe to, "Most people don't notice my acne as much as I do, and those who matter don't judge me based on temporary skin condition." This isn't denying acne reality but maintaining perspective. Social support is protective. Talking with friends, family, or support groups about acne-related stress reduces isolation. Many people are surprised to learn how many others have experienced acne and understand its psychological impact. Online acne support communities can provide connection and perspective from others who truly understand the experience. Professional mental health support is appropriate if acne causes depression, anxiety, or social withdrawal. A therapist can help with acne-related body image concerns, anxiety, and depression. Therapy combined with medical acne treatment often produces better outcomes than medical treatment alone for those with significant psychological impact. Dermatology-specific cognitive behavioral therapy, CBT, exists for conditions like acne where the medical component is intertwined with psychological factors. This specialized therapy combines dermatological education with psychological techniques for managing appearance-related anxiety and acne-related stress. If available, dermatology CBT can be particularly helpful. Mindfulness and acceptance-based approaches help by reducing the mental energy spent fighting against acne reality. Rather than, "I shouldn't have acne, this is unfair," acceptance involves, "I currently have acne, this is a medical condition I'm actively treating. I can't control its presence right now, but I can control my response." This reduces suffering while maintaining motivation to treat acne. Stress management is particularly important because stress worsens acne through multiple physiological mechanisms: cortisol production, inflammation increase, immune dysfunction. Therefore, reducing stress not only improves mental health but also improves acne. Meditation, yoga, regular exercise, adequate sleep, and enjoyable activities all reduce stress and support both mental health and acne improvement. Appearance-focused repetitive behaviors like mirror checking, skin picking, and comparing yourself to others on social media exacerbate acne-related psychological distress. Reducing these behaviors through deliberate practice improves mental health. Set limits on mirror checking, perhaps checking appearance once in the morning and evening rather than constantly throughout the day. Limit social media exposure, particularly platforms emphasizing appearance. Avoid picking at skin, which worsens acne and increases psychological focus on lesions. Goal setting around acne treatment provides hope and motivation. Rather than the vague goal, "clear skin," set specific targets. "I will consistently use my skincare routine for 12 weeks and reassess," or "I will make a dermatology appointment this month," or I will reduce skin checking from 10 times daily to 3 times daily. These concrete goals provide motivation and measurable progress. Celebrating small improvements maintains motivation. Rather than dismissing minor acne improvement as insufficient, recognize it as progress toward your goal. Each step forward is worth acknowledgement. Professional treatment validation through dermatological consultation helps. Hearing from a dermatologist that your acne is treatable and that you'll likely achieve clear skin with appropriate treatment provides hope. This hope reduces the sense of helplessness many acne sufferers experience. Family and friend education about acne helps create a supportive environment. Explaining to loved ones that acne is a medical condition, not poor hygiene or personal failure, often shifts their perspective and increases support. Medication consideration for acne-related depression or anxiety should be discussed with a mental health professional if psychological distress is severe. Combined medical and psychiatric treatment can be necessary and appropriate for some individuals. The timeline of acne treatment has psychological implications. Understanding that improvements typically take 8 to 12 weeks reduces the despair of not seeing immediate results. Knowing that this is normal rather than treatment failure helps maintain consistency during the early phases when visible improvement hasn't yet occurred. Guide 29, Acne-Safe Cosmetics and Makeup, Products that don't trigger breakouts. For many people with acne, cosmetics worsen breakouts through pore clogging or ingredient irritation. Understanding acne-safe makeup and cosmetics allows you to use cosmetics without exacerbating acne. This is particularly important for those using makeup for confidence or professional purposes. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. This condition differs from acne triggered by other factors, it's purely product-induced. Recognizing whether your acne is acne cosmetica helps you address the root cause, stopping or switching the cosmetic product. Non-comedogenic labeling indicates products formulated not to clog pores or trigger acne in most people. However, non-comedogenic is not strictly regulated by the FDA, and what's non-comedogenic for one person might be comedogenic for another. Non-comedogenic labeling provides guidance but isn't a guarantee. Foundation is perhaps the most likely cosmetic product to trigger acne, as it's applied to large facial areas and remains on skin for extended periods. Silicone-based foundations often trap bacteria and sebum more readily than other formulations. Oil-free, water-based, or mineral foundations are generally better tolerated by acne-prone skin. Powder foundations allow better skin breathing than heavy liquid foundations. Additionally, looser application, don't cake it on, reduces pore clogging. Primers can exacerbate acne by creating an occlusive barrier over skin. If you use primer, choose lightweight formulations and don't over-apply. Some people with acne find that skipping primer entirely reduces breakouts without sacrificing makeup staying power. Concealers often contain heavy pigments and binders that can clog pores. Use sparingly, focusing concealer only on areas actually needing coverage rather than applying all over the face. Cream concealers are often heavier than stick or powder formulations. Powder